Despite the fact that just 8% of COVID-19 patients had bacterial illnesses that could be treated with antibiotics, based on a UN World Health Organization report, the WHO has stated that antibiotics were being misused in these patients. According to the WHO, 3 out of 4 patients received antibiotics just in case, even though there had been no prior recommendations. Dr. Delphna Vernor, Public Relations Officer of the St. Lucia Medical and Dental Association, acknowledges the use of antibiotics in COVID-19 patients here in St. Lucia during the pandemic. However, according to her, it was used mainly in complicated cases.
As healthcare providers dealing with the novel infection, our focus was on managing the COVID-19 cases we were seeing, preventing hospitalization and death, which was a very real consequence of the disease. So although we knew COVID was a viral infection, antibiotics were sometimes used in cases of suspected bacterial co-infection or secondary infection in our more complicated cases.
Dr. Vernor also noted that antibiotics should only be used to treat bacterial illnesses. Nonetheless, many patients who visited the various respiratory clinics believe they required medicines in order to receive a satisfactory treatment.
It is important to state that antibiotics target bacteria and should be used for bacterial infections only. The majority of respiratory tract infections that we see commonly in the clinics, such as your common cold and flu, are caused by viruses. However, the reality is that a lot of patients come in with the notion that they need antibiotics to be treated appropriately, and so we are continuously trying to educate patients on this.
This misadministration of the drugs has raised the concerns within the WHO of rapid increase in antimicrobial resistance (AMR), which is a threat to the prevention and treatment of infections caused by bacteria, fungi, parasites, and viruses that makes medicines ineffective and infections persists, increasing the risk of disease spread. This, according to Dr. Vernor, is a global health threat. She notes, though AMR is something which can be developed over time, it is a medical practitioner's duty to be judicious when prescribing antibiotics.
So although antimicrobial resistance is something that happens naturally over time, the misuse and overuse of antibiotics can accelerate the process. Therefore, it's crucial for us as healthcare providers to judiciously prescribe antibiotics, adhering to the guidelines and using diagnostic tests to differentiate infections when needed. It is also important for the public to be aware about those risks and to ensure that we are using antibiotics appropriately so that these life-saving drugs remain effective for our future generations.
The WHO calls for the improved rational use of antibiotics to minimize negative consequences and prevent antimicrobial resistance. For Choice News Now, I am Chelsea Austinay.